Good morning, friends. I am Dr. Vishal Gupta and I am a consultant pulmonologist at the Chest Care Clinic in Kharghar. Today, I'm going to discuss with you a very important thing, and that is called obstructive sleep apnea. Obstructive sleep apnea can cause near total obstruction of the airways or a partial obstruction of the airways. That means that the breathing during your sleep can stop almost completely. This can be a serious event and it can have big important implications in your day activities as well as your work activities and your concentration levels, your energy levels. It can be a bed partner or a family member who can observe you snoring, who is not able to sleep because of your snoring, or who observes you gasping or choking for your breath. Individuals who are living alone may never know that they have this particularly serious condition. Symptoms can be hidden for a very large number of years, and people can get accustomed to the daytime sleepiness, the headache, the fatigue, and even a significant level of sleep disturbances, which is affecting their day to day activities, which is affecting their high blood pressures. And these people will never be able to understand what joy and beauty can come after the good quality sleep. The common symptoms of obstructive sleep apnea syndrome includes an unexplained daytime sleepiness or restless sleep. Along with that, symptoms can involve morning headaches, difficulty concentrating, and mood changes like being irritable, anxious, and having a constantly high heart rate and high blood pressure. Some of the difficult symptoms that people don't tell us are the reduced sexual drive, unexplained weight gain, an increased urinary frequency, and acid reflux problems that they are going through. These are silent symptoms, and most people will only tell their symptoms when asked about. So, it is very important that we should ask each other and also suspect these problems early for an early diagnosis. The so-called hypersomnolence or a daytime sleepiness is the most important symptom which adults have due to sleep apnea. In children, the symptoms of sleep apnea are basically a hyperactive child, and a child who is, even though quite active, is not a very good performer. He is finding it difficult to go to class and pay attention in class. He is having difficulty eating, or he may be a thin and a lean child as well. Obstructive sleep apnea in children can be because of tonsils or adenoid problems. So they may be having frequent cough and cold infections, and the patient may not be able to suspect this, may think it's an allergic problem. So it is important for the doctors to suspect this particular condition early and seek appropriate treatment as soon as possible. The increase in weight because of obesity will lead to a narrowing in the upper airways, which is because of the fat deposition around it. This, along with the existing sleep apnea, can cause a large amount of symptoms. So, most people, after a significant amount of weight gain, will start experiencing more symptoms of obstructive sleep apnea. Also, if the patient can lose weight in a good amount of time, these symptoms can become dramatically easier to manage. Men at the age of around 30 and 40 will have the highest prevalence of obstructive sleep apnea, whereas in women at this age the symptoms are less frequent. After menopause, these prevalences are as good as the men at that age. During pregnancy, because of excessive weight gain, the symptoms of obstructive sleep apnea become more aggravated. In order to diagnose obstructive sleep apnea correctly, we have to perform tests like polysomnography and home sleep apnea testing. These tests will help us understand the severity of the obstructive sleep apnea, which are critical in deciding the right treatment. During these tests, certain additional factors may come in which are very important in the treatment of the patient. During sleep studies, sensors like EEG leads, electromyogram leads, ECG leads, and limb movement leads are connected to the patient. Also, we tend to measure the pulse oximetry and the chest movements by using belts and oximetry machines. The serious outcomes of obstructive sleep apnea are mostly related to the excessive sleepiness and the sleep fragmentation that the people experience during the disease. After treatment, the sleep apnea becomes better and therefore they have an enormously improved quality of life. After appropriate diagnosis, the treatment options of sleep apnea involve a continuous positive airway pressure, which involves the pressure therapy from the nose by a mask into the throat, or a mandibular advancement device, or an oral retaining device, and myofunctional therapy and related exercises. In children, an active evaluation of the tonsils, adenoids, and nasal septums along with nasal passage is very important. OSA is a solvable problem and it has the potential to help a large number of patients who have cardiac, neurological, diabetes related issues, high blood pressure issues, psychiatric problems, and those people who have had weight gain during pregnancy. It will make a major difference to their life if they have been diagnosed and appropriately treated for obstructive sleep apnea. It remains a very much underdiagnosed problem and we are trying to get the best results by offering high quality services and care to our patients. So feel free to contact us at Chest Care Clinic Khargar.